Welcome to HIMSS TV. I'm Laura Levitt. I'm the managing editor at Moby Health News. Today we have with us Swapna Kakani, who is a patient advocate. Thanks so much for being here today.
Thank you for having me. I appreciate it.
If we could talk about your journey into patient advocacy and how you got involved with this work.
It really started at birth in an indirect way because I was born with a chronic GI rare disease called short bowel syndrome and have been dependent on nutrition from an IV and a feeding tube since birth. And then the short bowel syndrome, to manage it, I've had a lot of abdominal surgeries and a lot of new IV lines to manage the IV nutrition and just various complications. But it wasn't until pretty much in the last 5 years that I changed from a kid going through a chronic rare disease to an informed patient advocate, traveling around the country, giving keynotes on healthcare delivery and the patient experience from the patient perspective, but how can we partner with clinicians and the healthcare system to change how we deliver healthcare. And that really came about because I started seeing healthcare from both being in the bed and being on the other side of the bed. From internships in healthcare administration, internships in policy and advocacy in Washington, D.C. And from those experiences, really, and from the personal patient experience, felt the disconnect. And I thought my voice does need to be heard, and it's an important message to be shared. Let's start sharing it and partnering with various organizations to make my voice louder.
Yeah, and I'd love to talk a little bit about, where you see patients' role in innovation. How can their voices be included? I mean, especially sort of seeing it from both sides, how should that work in the future?
With innovation, it's really how we're advancing medicine. And what I always like to say, collaboration brings innovation, and collaboration with the patient brings innovation. When we're talking about advancing medicine, the patient is part of the solution. And if the patient's perspective is not received when developing the innovation, rather than only being the receipt of the innovation, then you're missing the point. It's just like anything we make in any other field, the customer's experience is the most important. So similarly, the patient experience should be thought of at every aspect of the innovation.
And now you're going to be presenting at AccelerateHealth in a few weeks. Could you talk to me a little bit about what you're going to be presenting on that panel, or what you're looking forward to in the discussion?
It's an honor to speak on the panel on telehealth alongside two amazing physicians and leaders in our healthcare system. And I'll be giving the patient perspective of what it's like to participate in telemedicine appointments and in healthcare today during the pandemic, but compare it to what it was like before. So something I'm excited to share is that today we're being much more reliant on patient-reported outcomes because the patient is not coming to the clinic and you're not being able to measure them or measure their height or measure their weight with your metric, with the traditional healthcare metrics, but rather you're asking the patient to own the responsibility of providing those aspects of care. And then something that's very different for me in my journey, so in my 30 years, I've had 65 surgeries, and in that many surgeries and in that many years, I have never been offered pre-op virtually or pre-op over the phone. It was always asked of us to come to the hospital, and in my pediatric care, the hospital was 2 hours away, and now I have care all across the country. And so that does require time off from either school or work, and my caregiver, which is my parent, to take off as well to make the appointment. And so to have appointments and pre-op that I do very frequently now over the phone, and in my mind it's still very satisfactory, was amazing. And unfortunately, it took 3 decades and a pandemic. And then something that is also unique is we have different motivation to keep patients out of the hospital for the first time.
During the pandemic, obviously telehealth has been a huge factor, but do you think this is going to change the dial on how this is done, in the future and after the pandemic too?
Yes, definitely. And I'm excited. I feel like telehealth is a topic that many chronic disease patients and family members have been speaking about it at the hilltops. And now it is hopefully a norm in many disciplines of medicine that it was not a norm before. I think it's going to be even more useful in mental health more than before, where individuals can access a mental health professional through telemedicine or even FaceTime calls if the practice allows it, because we're getting better reimbursement models by insurance providers. As long as insurance providers continue to reimburse it and cover it, both public and private providers, we should see a huge increase in using telemedicine across the board, both from providers as well as patients. And I hope that we change the equity landscape, in meaning more patients have access to healthcare. But I say that conscious of the fact that we have to remember everything is on a spectrum, and we don't want to create another inequity problem because not everyone has internet access. Here in Alabama, where I'm born and raised and currently living, we have a rural broadband service limitation. Rural areas in the state do not have access to broadband, and that's legislative topics being discussed, but we do have to be conscious of that.